everyone, and welcome to this very special live where we're going to be talking about dog training, dog behavior, reactivity, aggression, and pain. We posted a reel about this, actually reposted a reel from a veterinarian, and it went really big. We got so many questions. The original reel was basically going over some common signs of pain that are missed in pet dogs, and I think it went to almost 200,000 people, and I think we had a lot of folks who had follow-up questions. So if you've ever wondered about whether your dog's reactivity, fear, aggression, behavior concerns are to do with pain and discomfort, we're going to be speaking today to Dr. Grace, who is the veterinarian who made the original reel and who is the real specialist in this. So I've got you guys a real treat today. We're going to be talking to someone who spends all day, every day doing this. And then we're going to be asking and going through some common questions. So if you do have any questions, you can put them in the chat, but I've compiled a few talking points for us because I think it might take a little go rambly. And give us a moment while we figure out getting Grace on. If you haven't seen the original reel, it was really interesting. It was, I think, a compilation of videos from Grace's patients, all showing these various signs of pain that are often overlooked. So things like an odd gait, so walking in a way that's like not normal, quote unquote normal, skipping on the back legs, bunny hopping, where they push their two back legs together like a bunny instead of trotting, as well as many others. You can check it out. It's called I have Katie Kirk who's trying to join, but we're looking for Grace. Haha, there you go. You have to bear with Instagram, bless its heart, it's trying its hardest. We did it. Hello.
Hi.
How are you doing, my love?
Yeah, I'm very good, thank you. I have a day off, so it's always nice. Although, yeah.
Well deserved, I know.
Oh,
Welcome, Dr. Grace. I'd like you to introduce yourself a little bit more. Just tell everyone a little bit about yourself and the work you do, because it's fascinating. Please go.
Yeah, so I'm currently a GP vet, so just like general practitioner, like small animal vet. So mainly dealing with dogs and cats. Do get kind of the occasional like rabbit, guinea pig. My boss has a parrot, so she quite likes birds. In Bristol, so in the UK. I know obviously you deal with people who aren't necessarily just in the UK. So yeah, I'm based in the UK. Graduated in 2020, so in the middle of COVID, which was fun. So yeah, I've been a vet for roughly 3 years. And then I'm currently studying a further qualification to be registered as a veterinary behaviourist. So that started in February. So it's a self-directed one, just because I didn't have, it's a lot of money to go to a master's. So I'll just do it at my own speed. So yeah, about a third of the way through that. I have a Romanian rescue dog called Piper. Had her for 2 years. She has stranger danger and territorial aggression. She was probably what got me interested most in behavior initially. So when I went through uni, like behavior, pain, all this kind of thing wasn't like something that ever really like crossed my mind. I actually wanted to go and be a pathologist, so not even like a client facing thing. And then yeah, rescue a dog and your kind of viewpoint on stuff completely changes. So yeah, and since getting her, learning more about her, and then starting my course, learning lots of stuff about how, you know, medical things impact behavior. The whole sort of kind of goal really for me career wise has kind of changed a lot. So yeah, most of my work at the moment is still just normal, like, I don't know, sick animals vomiting and diarrhea and vaccines and that. But I do get quite a lot now of cases of either behaviour cases that come for second opinion. So they're working with a behaviour professional or a trainer, and they're, you know, hitting a bit of a brick wall with potentially their first opinion vet. So they'll come to me for a second opinion just to kind of overview things. Or I do get quite a lot of cases now who come specifically for like in-person gait assessments. Like musculoskeletal assessments. So a bit more of my day is that now, not just like routine stuff. But ideally, what is probably going to end up happening at some point is when I qualify fully, I'll either transfer fully into like veterinary behaviour stuff, or it'll be more that kind of like second opinion type work, and maybe slightly less. Oh, my phone screen's turning off. Ooh, slightly less of the like routine GP stuff, but that's a little bit about me.
Well, I think what's really interesting about your work and what's really cool for me is that we often work with sort of folks like you who have a special interest on their way to specializing. There are some vets who just will have a special interest in behavior, and you're mentioning you being like a, you know, second pair of eyes on the case. That's often the case in these scenarios, and I think that what you've been doing clearly, I can see, is like everything you've been learning and your experiences, you've been putting them all online, and I think that's been really helpful, because when it comes to identifying pain, that dogs are not going to say like, oh, that hurts. So it's all visual, right? And it's so brilliant to be able to use this platform and use the visual medium to just like show us what we do with behavior stuff. And I think it shows, because I like remixed your reel being like, wow, this is so fantastic, what a great compilation. And then this was like a million people message, and we were both like, oh, fuck, Jesus Christ. We were like, too many questions, I don't know.
Yeah.
Did not mean that to happen, but it was good, I guess, because it got lots of people interested in the thing and the whole topic. So what I've done is gone through the millions of cost questions that we got from reposting that reel and like distilled them down. And I thought we could ask you, just rather than us trying to go in the comments and like keyboard warrior it out, we can just like chat about it, and then folks can hear it straight from the horse's mouth, or the doctor's mouth in this case. So the first big question that folks have when we bring up pain, because I think it can be a little bit overwhelming, just like your dog could be in pain, or there's a high chance that there is pain. What does that even mean? Like, are we talking about like one specific type of pain, multiple different systems? Could you just like talk to that a little bit for folks?
So yeah, so you've got your main kind of like pain pathways in the body. So that's, you know, all the way from your brain through your central nervous system, all your peripheral nerves, and then you've got where those peripheral nerves go to. So joints, muscles, skin, GI tract, to name kind of a few of them. So we're normally looking at pain in sort of specific body systems, and sometimes we can have multiple things going on at once. Usually in a lot of our behavior cases and just general like first opinion sort of practice, usually what we're looking at is musculoskeletal pain, gastrointestinal pain, and like skin disease are normally going to be like your top 3 most common kind of presenting issues or things that dogs may struggle with. After that, you're getting to more kind of weird like neurological things, which are like far less common. Within musculoskeletal, I will normally include things like disc disease, or like bulging discs, or, you know, like nerve impingement, just because it's kind of more in that sort of section. If you were thinking of neurological things, I'm normally thinking more of like seizure type problems. But yeah, normally we're looking at joints and muscles, gastrointestinal tract. So that's anything from like your esophagus, so like up here, or like stomach, small intestine, on like that, the whole system,
all the way out.
And then skin and ears is, yeah, you're normally thinking of dogs with sensitivities or allergies, or is prone to ear infections, like that kind of thing. They also all cause pain, so they're normally the things that we tend to kind of think about or want to at least like rule in or rule out.
Yes, such a useful overview, because I think obviously I'm not a medical professional, and often but behavior professionals are speaking to our clients who are like, there's something wrong, there's something going on, there's some sort of pain, and it can seem a little bit overwhelming to just be like, I don't know, somewhere in the body there is pain and we have to figure it out somehow, like some sort of bizarre mystery. But like bringing it down to those basics to start off with, we're looking at like the body, the muscles and the bones, and then we're looking at the GI system and the kind of that gut, and then we're looking at, what was the third one, skin and ears, and kind of the periphery, that kind of outside, the coat that wraps it all up basically. And starting off ticking those three off is a really useful way, and like helps it be a little less overwhelming, I think, for folks. I guess though, and this is kind of my own interest as well, but people did ask this, sometimes it's kind of hard to know which one to go for. And I guess, do you have anything to say? This is me now. I'm just like, this wasn't even really a question from the audience. I'm just like, tell me now, like, how do you have any like markers that you're like, if I see this, I really look to this area, something like that? I'm just curious.
So I will normally have, so unless the person comes in and they're like, oh, my dog is limping, or there's like an obvious thing that they're coming in with, if it's a behavioral case, for example, and it's coming in, so normally I have pre-appointment questions, which are normally trying to sort of pick out finer details which could hint at certain things. Normally for musculoskeletal stuff, a lot of their signs can be incredibly subtle. Like, I'm talking, you probably won't, I can point things out to people and they're like, I never even noticed it, but now you've pointed it out, it's really obvious. So that's normally clinical exam findings tend to be more, I can't think of the word, like we just have to do a clinical exam or
see the dog and walk them around and like have that one-on-one time with them. So that makes a lot of sense, yeah, especially for like the gait analysis stuff that you seem to really,
a lot of things. Like if we have clients who have dogs that who they really struggle coming to the vet or being around people, I have had cases where I've done them, so they're registered like at the practice, but instead of them bringing the dog to the practice and me watching it walk up and down and take videos, I just say, look, can you take videos from these specific angles, walk and trot, and then send them to me, and then we can do it like remotely, because that's going to be like less stressful. But in terms of sort of wider behaviors that I would tend to start having little like red flags raised in my head, that we could be looking at pain as like an underlying exacerbating factor or causal factor. So any dog that really struggles to settle, so any dog that's struggling with sleep, any dog that they're just pacing and they're fidgety and they kind of get up and down and they just can't seem to get like comfortable, definitely wanting to rule out pain. Dogs that are really noise sensitive, any dogs that have resource guarding or mark like handling sensitivity, especially if we notice oh, they don't like it if I try and touch or groom or do something in like a really specific area of their body, that's normally quite a big red flag that there's potentially something going on. Or any dog that has like defensive or like aggressive behaviors are normally kind of the big ones. You can then start getting more like subtle signs. So often these aren't as easily picked up, and they're normally only picked up in like certain like dog populations. So I don't know, say you did trick training or you did agility with your dog or you did scent work or something, and you're telling the dog to do certain cues and they're like not kind of doing them as well, or they're a bit slow, or you're trying to teach them something new and they're just completely like not getting it. And normally they're kind of like, oh yeah, like I kind of learned things at a fairly like standard sort of speed. I would then potentially be, again, maybe questioning things. Same with if we're looking at appetite changes. So appetite changes aren't necessarily just like gastrointestinal tract specific. Obviously they can be, because eating is part of the gastrointestinal tract. I'm also then looking at musculoskeletal pain or like chronic stress, those kind of things. they're normally what I'm attending to go, I've got a dog that resource guards. I should probably, want to rule out pain. That's probably like quite a big thing that we might need to check.
And I love how you're like, as you're going down that list of like common behavior concerns that ping up red flags for you, it's the same, really similar to what we do as well on our end, but just from the other side of things, obviously. And I think it's really important for behavior professionals and for guardians to know that lots of times we're going to dog trainers who are essentially like behavior therapists, I guess, in some way, for problems that are actually medical, and both the training professionals and the guardians, both of them informed this is actually going to be a medical thing first and foremost. And yeah, resource guarding, like you said, any handling related issues. We see lots of like startle related stuff, dogs who struggle with like a sudden change, someone moving suddenly, and noise sensitivities. And I love that definition that you said at the beginning, just like unable to settle and like fidgety. And I almost think of it as itchy, and they almost look itchy a little bit sometimes, and love all of that. That makes a lot of sense. How much of that is just normalized though in the dog population? That's just what dogs do. Isn't that such a bizarre and dangerous thing?
I get a lot of second opinions. So there's someone who, she's a friend of mine, she's a dog trainer, she works in Bristol. She sends a lot of her cases to come and see me, and half the time it's because she's just like, I just send them to the vet, and like they just say, oh yeah, that's just how Labradors walk, or that's just how Springer Spaniels sit, like I think. And I'm just there just like, oh, okay, yes, they can come and see me, that's fine.
Yeah, it's so, if only we could send everyone to you, Grace. That would be so, everyone go to Grace. You're gonna have to book if you could take a boat and take your dogs on Grace. But I think what we're seeing is potentially just like a lack of awareness and understanding around the subtleties here, which you so obviously are so clued into. And it's like you said, like often you don't notice these things until it's pointed out, and then suddenly you go, oh crap. So much more sense. They're not just stubborn, they have a joint issue in that hip or something like that. They're not just crazy, they have a GI issue, and so they're constantly feeling irritable and itchy. So this big challenge that I think lots of guardians come in with, and this is the biggest thing by far that we've got in as a response, was just this problem that you're mentioning, which is I took my dog to the vet, my local vet, who obviously isn't a specialist in any of these areas, and because this stuff is so normalized and pain is so normalized in the dog population, even these practitioners are kind of just going, no, I think it's fine. Obviously, your number one recommendation is bring them to Dr. Grace. But outside of that, what you're mentioning a second opinion, maybe some like tips for folks about next, how to maneuver.
I guess firstly, if you are booking in, to see your vet, I would, for something that is related to, you're seeing a trainer and they want you to get a vet check, or you're seeing a behavior professional and they want you to get a vet check, I would normally say try and book at least half an hour if that's possible. 10-15 minutes is not enough to do most of the things that need to be assessed. I mean, in a lot of these cases, like a very lengthy medical history can take at least 20 minutes, a minimum of like 20 minutes to be able to take. In a lot of these cases where it can be quite complex and we're trying to pick up very subtle signs. Plus, if we have a lot of our patients who come in, they're very, very stressed about coming in to the vets anyway, which means that 15 minutes, like even half an hour, some of these guys are still like just stressed for like half an hour. But 15 minutes it's not enough to be able to do everything that we need to do. It's not enough for, if your dog takes 10 minutes to be able to like kind of just self-regulate a bit and be okay about the environment, you've then got 5 minutes to get some level of kind of clinically relevant data, which isn't long enough. Most of the time as well, I'm saying if you can keep diaries, so anything that's like longitudinal data is great. Vets are like, we like data, we like lots of data, we like numbers, we like patterns. Bring as much data as you can do. If you have videos of your dog doing the specific thing that you think could be a problem, or you have videos of your dog walking, then bring those along. It's kind of a collate as much information as you physically can do. and bring it to the appointment, especially if your dog struggles around being examined and that kind of thing. And we might have to do more of a like distance exam. A lot of the time I do have to tell people, if you're really, really concerned that your dog has a level of underlying pain and you're not being listened to, you kind of have to do the really I would find this uncomfortable because I'm not a very assertive person, is you just really pushy, and you just have to say you want to do a pain trial or you want to do like this specific thing. And technically, as long as prescribing that medication or doing that investigative thing, say you wanted to do radiographs, for example, as long as that's not majorly contraindicated for the patient, I technically couldn't deny doing it for you. You sometimes just have to be a bit pushy. Some vets don't like it when you're pushy, and they kind of do the I'm the vet, you're the owner, like I'm right, you're wrong kind of thing. In which case I'm just like, I just don't see them anymore. It gets difficult because I know that sometimes you do feel like you're smacking your head on a wall, like, and it's awful. And I think it's because even in veterinary, like even in human medicine, like pain is not very well understood. We're probably 5 to 10 years behind the human medical field in terms of like being able to understand these things. Plus then you've got a patient that can't talk to you and tell you anything. So a lot of stuff does just go, oh, I've manipulated all the legs around and they didn't yelp out or they had decent range of motion, they're fine. Is that it's hard. Like, I'm not gonna sit here and be like, oh yeah, you know, like we all vets just know about this stuff, because a lot of them don't. Like, this is an area of interest for me, and like if you came to me, I don't know, your dog had an eye problem, I'd be like, I'm not good with eyes, like I'd probably go and see somebody else. So yeah, normally I tell people, get as much longitudinal data as you can do. Get videos of anything that you're concerned about. Sometimes you do just have to be a bit pushy if you're only able to see one vet. If you're able to see, some places will have multiple clinicians in one practice. If you're able to see a different one, or you have one that you trust a lot, and you like have a good working relationship with them, then I would preferably, you know, say to go and see them. If you're still really struggling within your practice, you are well able to go and get a second opinion. I think that's easier to do in the UK than other places. My knowledge of the US veterinary system is not great, but I think that sometimes it gets a little bit more challenging because their system works slightly differently to the UK. But normally I say try and get a second opinion if you can do, from someone who potentially, you know, isn't in your practice. And yeah, if that's still not getting anywhere, then you just have to do the really uncomfortable thing and just be really pushy. Also, there's a very good paper which I think is called Mills 2020, and I can't remember. I'm gonna see if I can find the name of it. I've got my computer. The actual name of the paper. I normally tell people just print it off and take it to their vet and be like, this paper said to do this thing, because it's a really good paper on pain and problem behaviors in cats and dogs, and it's Mills 2020. It is a very, very, very good research paper, which goes through a whole introduction. It goes through the fact that about 60 to 80% of behavior cases have some underlying medical concern. It goes on to how pain can manifest as behaviors. It goes through lengths that they did pain trials for. It has a load of like case studies in there. So normally I tell people, if you're really struggling, print that research paper off and just take it to your vet, or tell them to read it, because I think veterinary behavior is not an area that most general practitioners know very much about. It's often poo-pooed as a specialism. It's like, oh, you're not like a real vet if you do behavior, kind of thing. Yeah. And it's very poorly understood. So we have so much stuff that we have to learn. I normally just tell people, just take this paper, because it just goes through everything really well. And then you're like, but this research paper says to do this thing, which is that you're being evidence-based anyway. It just gives you a bit more like backing, because sometimes professionals need a bit more nudging in the direction that you want them to go in.
Get to outsource the pushiness to the paper. You're like,
Yeah,
I'm not being
yeah.
pushy, but Mill et al. Said.
It's like,
I love that overview. I think first of all, just like I like to have really open and like open-hearted conversations about how the medical industry is sets us all up to fail. Like, this is no individual veterinarian or any individual practitioner's fault, as much as it can be very frustrating. And just like you're saying, like, even we don't understand pain and how this works in humans fully. And I've been the dog in the human medical industry where I've been being knocked around between professionals because of my chronic pain, which was dismissed, and then later we had to figure it out ourselves using exactly the method that you gave me just now to advocate for your dogs, which was book longer sessions, go in with data, go in with videos, be pushy, bring in the research. You could even ask for specific things, like, if I want a pain trial because of this. And obviously I would never usually be recommending anyone tell any doctors what to do, but in some cases you can suggest, I think, and I think that that's okay, especially if you're in a location where you're very limited, because we work with clients all over the world, and like, some people are in the middle of nowhere and they have like one vet and there's no other options. And for me, we're really lucky, like you mentioned, in the UK, for our dog Emily, she has like grade 3 luxating patella in both of her back legs and arthritis, and we went to 5 different vets before we got that answer for her. And because I'm just a stubborn so I just would not give up. I was like, I know there's something wrong, her back legs look weird, until we figured it out. But I love that like giving everyone the okay to just be a bit pushy. I think.
And like you said, not that, it's not that vets are doing it, like, they're not doing it on purpose, and it's not that they're like bad or they don't know stuff. It's just because, especially if you're a GP, like, you have to know so much stuff. A lot of the time, like, you do have to kind of park in areas, and pain is probably one of them, that, which is not great, but pain is probably one of them, and behavior, that does get parked a bit and gets sort of shoved in the corner as this kind of thing that exists, but they don't really like pay much sort of notice to. The other thing I thought as well of is, if you have, especially if you're thinking of like musculoskeletal conditions, if you can get other paraprofessionals on board to back you up, that's another thing that will help. So if you see a physio or you see a massage therapist or someone, that can really help as well, because they'll write reports and stuff that your vet can read. That can often help as well.
Yeah, fantastic. That's a really good, really great point. And yeah, specialists who can look at like your dog's movements and muscle patterns, etc., can be brilliantly helpful. I think we took Emily to a physio who like immediately identified her problem on the spot, just looking at her walk, and I was like, for God's sake, why didn't we come to you in the beginning? So that's great, a great piece of advice there. So we've got a bunch of information, I think, already. My next and like kind of last point that I had on my list, and I know we had a few good questions in the chat, but I just want to confirm, is a physical exam enough to rule out pain? Because this is a contentious point that I see on the internet so frequently, and I know where I stand on this, but a physical exam, is that enough to be able to rule out a dog being in pain, from your understanding?
So from my understanding, it isn't. It's, I mean, even like a physical exam is not enough to rule it out. Even if you did diagnostic imaging and you didn't find anything, just because you can't physically see something doesn't mean it exists. Doesn't mean it doesn't exist, sorry. The only way you can actually rule it out is to trial pain relief, like medication. If you're not noticing any positive effects, and sometimes you need to try multiple medications, or you need to try combinations of medications because they work in different ways, is that you can't say the animal isn't in pain. Same in people. Like, we have entire pain conditions that exist in and solely in and of themselves without any like actual like structural issues. Like, my sister has fibromyalgia, and it took, how old is she now? She's 21, and I think it took like 8 years for her to get a diagnosis. And and that's literally a condition like in and of itself. We probably have those conditions in animals. They're just not studied or well understood, or research is coming out on them. Just because you can't find anything structural on a CT or on an MRI or a radiograph, or because you can't find anything on a physical exam, doesn't mean that it doesn't exist.
I'm so glad that I asked that last question, because I think this is a point that I don't talk about enough and isn't talked about enough, which is that like it's actually really hard to rule out pain. Like we say, we got to rule out pain, but like it's actually not that easy to do that. And sometimes we'll try. First of all, you're mentioning pain trials as like a first port of call, which is absolutely something that the first thing that we'll be like doing with a veterinarian as well, which is just for anyone who doesn't know, we use pain medications for multiple weeks, often months, depending on who you're working with, to see if there's any change in their behavior, in the way they move, and in any patterns of their behavior. And that can often help us know, okay, yes, there's something going on here that we have to investigate more. And I love, first of all, you mentioning that, like, from my understanding, you need to do these sort of pain trials for a month minimum, often a little bit even longer than that. So we're looking at that timeline just for one pain trial. But then there are multiple different types of pain medications that you might use. Like, from my understanding, it'll be like an NSAID versus something that works like gabapentin or something like that, for example. Different works in different ways. Not an expert, don't know how that works. But I think highlighting from what you're saying there, what I really want to highlight is that like you might have to ask the dog in like 10 different ways. Are you in pain? Are you in pain? Are you in pain? How about here? How about here? How about here? Like, it's not like, oh no, they're not in pain, we ruled it out. And I think that's a really important point. So yeah, I want to go back to you. I got excited about that.
And I saw someone say, especially with chronic pain, 100%, like chronic pain is so hard, like to diagnose, really difficult to diagnose. It's really difficult often to get on top of. You need multiple you need to basically create a pain plan. Like, it's not just a cool, just take this medication, you'll be fine. Like, you need to do lots of different things, which can be, environmental management, changing exercise regimes. You might have to go and see other therapists, look into complementary therapies like, I don't know, massage and acupuncture and laser therapy, and like there's so many, as well as looking at pharmaceutical intervention. Like, it's not just a cool, take these drugs and we fix you, which would be great. Which would be great, but it's not. Like, you have to do like this whole encompassing thing, with lots of little bits that all kind of fit together, which I found because, well, Piper has hip dysplasia, so we diagnosed her in February. And yeah, she has a whole thing, and I spend many hours worrying that it's not the right thing and that she's somehow in pain. And my partner's like, Grace, shut up, she's fine. Like, she's you track like all this data and nothing has changed. I'm like, yes, I know, but what happens if it isn't? And he's like, it's fine.
I missed one data point.
Yeah.
I love that, actually. And I think it's really funny because I've been having this conversation in my private life with humans who have chronic pain, who are coming to terms with their chronic pain conditions. And I think for lots of us, we say, we think there's chronic pain, or there's some sort of pain condition or something going on that's painful. And it can be like, oh no, my dog's in pain. Or, you get the diagnosis that your dog has arthritis, or maybe a spinal condition or something that might be issues. That is, to me, the opportunity for healing. Like, I know it sucks to know that your animal is experiencing pain, but unless we identify that, there's no way that we can move forward. And there are so many things that we can do to manage, to reduce, and to like monitor pain levels with our dogs. Even though there's no quote unquote cure or quick fix, I also want to give people like hope, because these pain plans that you come up with can absolutely turn around quality of life. 100% turn it around. It can perform magic with behavior. I'm not gonna lie. Our rescue, Romanian rescue, also Emily, she, with the double lux inhibitor, the arthritis, we started treating that, pain management, medication, changed her diet, doing physio. 90% of her problems gone, completely. It's like magic, but I could never achieve that with operant training. Like, good luck. Like, that's not going to happen. I mean, 5 trainers tried before me and failed. And so I think that piece of like hope is important as well, is that even though yes it's going to be a bit of a journey to figure it out, and you might have to trawl through a less than ideal medical system and a less than ideal dog training industry as well, like there is a lot of there are people like you and people like me who are like really interested in this and here to help combat the kind of gaslighting, I guess, that inadvertently can happen when pain is not acknowledged over and over again. So yeah, I think lots of people will probably be feeling a lot of like, from my experience, a lot of like often feel like validated, I think, when they hear professionals like you talking, because you're so knowledgeable, you have evidence-backed practices, and you're validating their experience, where you're saying, actually, no, when your dog does sit weird, you're right. You are right for that. And I think, yeah, I think everyone can give Dr. Grace a little clap for thank you very much, Dr. Grace.
As well, to be fair, on the flip side of that, obviously you do get a lot of cases where, you know, people will come to you like, I think this is a thing, and they want you to listen to them and be valid. I get the flip side of that as well, where I have a lot of people who you will present them with you know, clinical findings and those kind of things, and you just get like shut down, or you're just told that no, that like can't possibly be a thing. And I probably feel like it's that thing of where I'm like, I understand, because you don't want your dog to have a medical condition, you don't want your dog to be in pain, and that's like a scary and overwhelming thing to think that you have to accept. And you're not bad people for doing that. It's the same as like, I've had cases where they've gone, I don't know, it's taken them 2 years to get a diagnosis or something, or they finally felt listened to and got something, and they feel really guilty about it. And I'm like, it's one of those things where, I don't know, it's a bit shit and it's not great, but we've got there, and that's fine. It's not bad. It's just one of those things, and now we know there's a certain concern, and we're going to address it, and we're going to work together, and you know, we're going to make a plan. Like it's okay. Like it's not the end of the
world. I think what I'm like, that really resonated with me, because what I'm really hearing as the theme there is that like emotions run really high when there's pain involved. And like that can be people who become guilt ridden about not having identified it earlier, and stressed about advocating for their dog well enough. And then on the other side, you have folks who shut down and who are unable to kind of accept that. And like, okay, so I'm just gonna put my mum on blast right now, but that's my mum, because my family little Shih Tzu has been struggling, and I've been pointing it out for a while, and she's been struggling to take it on board. And when you were talking about that, I just saw her in my head. I was like, that's exactly what that is. It's that you don't want him to be, you don't want to see it, and it's just no judgment to either. No judgment to either end of that spectrum. Like, that is normal human reactions to these situations, and it can feel very overwhelming, but just like shining a light on it, let's just notice it, not just say that's normal. And like you said, like at some point we will get to the bottom of it, and there's no pressure on anyone to solve it right away. Like, it can take some time, and that's okay.
My parents are the same. Literally.
Oh my God, the worst. Why do they do this to
us? A Labrador, who he's literally never had any like medical concerns, never had any behavioral concerns, like nothing. He's like stellar dog, great dog. He very recently started having like a lameness problem with a forelimb, and I was basically like, he's got elbow dysplasia, he's a Labrador, it's elbow dysplasia, and to proven otherwise. And I think I probably told her this about 10 times, and eventually I took it to the vet, and that kind of like resolved, and like the limping kind of went away. And then he started more recently with some like behavioral issues, and he's never ever had behavioral concerns before. So he started getting more like, kind of, I'm going to label it as grumpy, like a bit more grumpy with other dogs. He's never had an issue with dogs before. He started getting very distressed because he sleeps downstairs. He would get very distressed at like certain times of the night, and like this would never happen. I remember my dad came and he asked me, and because he was worried and he wanted to help him, but I kept being like, he's in pain. Like, it's pain. It's like, just do
dysplasia. I said it 6 months ago.
Give him the pain relief, for God's sake. Eventually did it, and then look, it solved the issue. I was like, look, it's like,
almost like you're an expert in your field and really know what you're talking about. It's the hardest people to convince you.
It's always parents, isn't it? But yeah.
No, but I think it's good because they're human, you know, and that's like, these are normal responses for human beings to have, so it's important to talk about it as part of the conversation, to like shine a light on it, make sure that there's no judgment, and also less frustration for the professionals involved as well, because it's important for us to be able to be like, yeah, this is a thing that happens, and like that, it's a bit weird and a bit annoying, but we deal with it.
I was going to say, just going back to your point on the kind of clinical exams and running out pain, I have this one case, because this one case told me so much, and I always think of it when anyone ever asks me this question. So he was like a 4-year-old rescue dog. He had a history of like GI problems and skin problems. So, you know, we started like treating those things. He was so nervous and like anxious about things, so I could never like physically like touch him. And I remember them coming because he had an episode of like one episode of like startle aggression, and I couldn't examine him, and my brain was like, oh no, he's probably not painful, like it's fine. And I was like, no, you have to, he has this one thing, you have to do the pain trial, like you have to do it. So I put him on non-steroidal anti-inflammatories. 2 weeks later I saw him, he was like a different dog. It was insane. Like I could touch him, I did a whole clinical exam, like without him being like really stressed. He wasn't trying to like flee or run away or like pin himself in a corner. He was like, yeah, you can examine me, like this is fine. And I was like, I have no idea where he's painful, but you can just keep having the pain meds, like that's okay. But it was like this one thing, because I genuinely didn't think that this dog had pain, was like musculoskeletal pain. And I was like, no, he's presenting with behaviors that are related to pain, you have to treat him for pain. And I did, and then it got better. And I was like, yes. I always think of him every time that someone asks me that question.
As a professional, I've had that exact experience. For some reason, there's some internal bias that I have that's telling me this dog doesn't have this thing, even though all of my like flowcharts in my head that I've created, they're like, no, you have to do this, and I'm like, no, because of this. And it happens with our trainers as well. We've talked about it before. And having to just go like, no, I'm not listening to my brain. There's a reason why we have these systems in place. Follow the goddamn flowchart, yeah, and you get to the right answer. And I think, yeah, definitely speaks to like power in data, power of just like following the system that works. And like you're saying, if you're seeing these signs, don't say to yourself, oh no, not my one, not my one. You're fine. If you're there, just turn around and go back and then email your vet.
And especially in these cases, like the worst thing that happens is that, okay, obviously your dog could have a side effect of medication, but in theory the worst thing that happens is you do a pain trial and it doesn't help. That's literally like, cool, you've done 4 to 8 weeks of giving a medication and it's not really done anything, and then like there you go,
well, you feel fine, there you go, well then back to training. Like, yeah, literally that's it. So I love that, and I love all of this stuff that we've talked about today. It's been so helpful and so validating for me as a behavioral professional, because obviously I'm not a medical professional, but I also am not blind and do these things this a lot, spend all day talking about dogs. So and dogs that struggle with behavior issues, so we know that they have often got these things. So thank you so much. And I think my phone is telling me I'm running out of battery, so I'm gonna have to finish. But you know how it works. ADHD time management is when the phone's running down, you know that the thing is coming to an end. But this has been fantastic. I've had an amazing time. I think everyone who's been here has had an amazing time. And if you're watching this live, feel free to go and make sure that you follow Grace. Their handle is Piper and her vet mum with underscores underneath. And obviously it'll all be linked under the video, so you can go and follow Grace, because Grace has amazing content which gets into the really nerdy details of this stuff, as you can imagine, which for us, we live there, we love it. And I think lots of guardians really benefit from it, so check it out. And Grace, maybe I'll be able to wrangle you on again to get even nerdier and get into some details, because I'm sure folks will have another whole swathe of follow-up questions.
Yeah.
You're like, yeah,
open the door. You just have like, you're like, wait, I've learned a tiny bit of information, I need to learn more information. And then you
100%, yeah, let the information download begin, because yeah, I'm yeah, fascinated by all of this. All right, thank you everyone who joined us and stayed all the way to the end, and we will be seeing you around the internet. Thank you, Grace. Have a lovely evening. Give Piper a big kiss from me.
I will. Bye.